Hi guys, my name is Catherine S. I am one of the tutors here at Chegg. I usually tutor science, some math, English, and Spanish, and today we are going to be talking about the 4 Ds of negligence, which is required for medical malpractice. All 4 of these Ds have to have been met. So what we're going to do is go through what each of the 4 Ds are, as well as some circumstances where you might meet some but not all of the characteristics, and why that would not be considered negligence. So the first D is for duty. As soon as there's any sort of patient-client relationship, patient-doctor relationship, there's a duty there. The distinction being that a doctor does not have any duty to the person who is sitting next to her on the train, to distant acquaintances, to somebody like that. It only applies for people who are his or her patients. When there is a patient-client relationship, however, then we have the opportunity for the other Ds to occur. So the second D is for dereliction, which is when a doctor breaches his or her duty, when they have a duty to do something for their client and they don't. For example, if your client comes in for just a regular checkup, or actually, if your patient comes in because they have something wrong with their foot and they've been having some ankle pain, and they mention offhandedly that they've also been having headaches for the last 2 to 3 months, but they have been drinking enough water. If you make the decision to just assume that it's probably just stress, and just treat the ankle, then you are guilty of what's called dereliction, because you have a duty to your patient to say that it could not just be stress, and that given, based on your judgment of the situation, that you might recommend further testing, or to at the very least tell them that it's something that they should be concerned about. So the third D is for direct cause. Direct cause happens when, as a direct cause of your dereliction, there's something negative happens to the patient. For example, if the patient in this question, in this circumstance, actually had, for example, some sort of brain tumor that could have been better treated had they known earlier, their inability to treat it is a direct cause of you not telling them that they ought to go in for some scans, for example. And finally, the fourth D is damages. If the patient, if treatment costs more because it took you longer or it took them longer to realize that there is a problem, if, for example, they don't recover because of this, any circumstances like that, that would count as damages. So this situation that I've just described, where a patient comes in with one problem like a foot pain and mentions a headache, and then the doctor does not fulfill his or her duty, does not say anything about it, and as a direct cause of that, the patient becomes much more ill, or perhaps even dies. Because of that, this counts as negligence. So now we're going to be talking about times when this would not be negligence. So if the doctor, after treating all of his or her patients, is on the bus home and offhandedly hears the person next to her say, oh gosh, I've had the worst headache for months now and I drink enough water, I don't know what's going on. The doctor does not have any duty to this person. He or she, maybe if they saw fit, might say something, but they certainly are under no duty to do so. Dereliction would not be met, obviously, if they did say something, or if it's in a circumstance where they could not have known that information. For example, a nurse would not be guilty of dereliction if she didn't point out, or he didn't point out, a condition or a possibility that he would have no way of knowing about, because it would be more under the training, for example, of a neurologist. It's based on what a person is expected to know as well. Third, direct cause would not be met. For example, if the negative thing that happened to the patient was not related to what had happened or what the doctor had failed to say. For example, if that same patient came in for the foot pain and mentions offhandedly the headache that's not, that is not treated or not focused upon enough, and then later goes home and I don't know, their appendix ruptures because they, have been having some pain in the abdominal area, but they didn't say anything. Nothing, that's not the direct cause of anything that the doctor did. Um, it Another example of that would be if a doctor provides medicine for a patient and then that medicine causes an allergic reaction, but there was no way for the doctor to know that. It wasn't because of the doctor's negligence that this happened. It was because of the medication and unknown information. And finally, if there are no damages, then there's no cause for a medical malpractice suit. Using the example from before, if the headache really was about stress, then there's no way that the patient can sue the doctor because the doctor said it is probably stress. And there are no damages to sue for. So yeah, that is a basic overview of the 4 Ds of negligence. I hope you enjoyed and learned something.